Hello and bienvenido, San Antonio. Welcome to the Alamo Hour, discussing the people, places, and passion that make our city. My name is Justin Hill, a local attorney, a proud San Antonioan, and keeper of chickens and bees. On the Alamo Hour, you'll get to hear from the people that make San Antonio great and unique and the best kept secret in Texas. We're glad that you're here. All right, welcome to today's episode of the Alamo Hour. My guest today is Dr. Gary Slutkin. Dr. Slutkin is a medical doctor and epidemiologist. I'm stealing from your TED Talk bio a little bit. You're an innovator in violence reduction, which we're going to talk about. Currently founder and executive director of Cure Violence. Also, consigliere of sorts to some Metro Health and mayors and city officials who are, seeking your guidance on COVID. Dr. Slutkin's previously served as medical director for the San Francisco Health Department. He's worked for the World Health Organization. He's worked on epidemics all over Africa, which we will discuss. Importantly, he is a well sought after epidemiologist on using data and science to cure issues, and specifically issues that people probably didn't think could be cured that way. So, Dr. Slutkin, thank you for being here.
I'm happy to be with you, Justin.
And you're in Chicago, right?
Yes.
All right. You are my first non-San Antonio local, or someone who's lived here for some amount of time, but our show tries to have a real connection with San Antonio. And Dr. Lesh, a previous guest, and Mayor Nirenberg, also a previously guest, have discussed COVID with you. I know you've provided some guidance and counsel. Talk to me about what you're doing right now in your role as sort of providing some guidance to cities and leaders, including our very own Mayor Ron Nirenberg.
Well, I'm aware that the U.S. has not really seen anything like this before. That is to say, an epidemic of this nature that's so fast, so contagious, so lethal. And many other parts of the world have. And I had the opportunity to be helpful with World Health and some of the others. So although I myself have largely been working on reducing violence in this country and in other places recently, I had to quickly switch into a role of helping and supporting and guiding and training where there were needs, which is basically wherever you look, in how to manage this, because it's not clear. I mean, besides the fact that it's new, a lot of behaviors need to be changed. People don't like to change behaviors. People don't want to change behaviors. And, there's so much misinformation as well. So, yeah, I've been talking with mayors and governors and the mayors associations and the governors associations, and trying to help understand what needs to be understood here, which is that, you can't tell who's infectious and who isn't, which is a really counterintuitive thing, that someone or someone who looks well could be carrying it, that it's really that serious, that you can get it even just by talking and screaming or talking loud, or it doesn't require coughing, and that the results are really quite bad. And so for policymakers, they need to really make this so serious, and whenever we don't, we see the consequences. And that has to do with the fact that the virus, jumps when given a chance. And so opening up means opening up for the virus, and that's what everybody saw, but not everybody knew it. And then also what the people themselves have to do. So yeah, I've been guiding and training in this arena since late February, early March.
And have you just sort of seen, I mean, we've all sort of seen what's in the news, and we know what we're told in the news, but, San Antonio did really good at first, and we were all very excited, and we were patting ourselves on the back. Then our state opened up fast, for which San Antonio had to follow lead, because mayors like Mayor Nirenberg have very limited sort of authority to outstep what the mayor says. Did you see that sort of across the board throughout mayors and policymakers who you consult with, that cities that open faster had the bigger problem? Or are there still some unknowns to how it's spreading or why it's exploding in certain areas?
There may still be some unknowns, but the main things are known and just weren't paid attention to enough or taken seriously enough, or confused, intentionally or unintentionally. But what you said about San Antonio, and probably for other cities too, but San Antonio, I seem to know better because I've been talking with the mayor and other people there, is that it's exactly true. San Antonio was doing terrific, amazing, actually. The rates and numbers were exceedingly low. And Mayor Nirenberg and the city responded extremely fast. They were aware of this in January. They called an emergency, a health emergency in February, restrictions in late February and early March. It seems they were being followed. The number of cases was maybe even the lowest of big cities in the country, certainly one of the lowest.
Yeah.
Contact tracing was getting going. And it seems that there was a reversal, that the mayor and other mayors were not able to manage so well because of the conflicting communication and conflicting orders. And it's an exceptional tragedy. I mean, I have a lot of confidence in Mayor Nirenberg, and the other mayors several whom I met just last night, that they're going to get on this of stopping the spread now, but they are behind, and it's clear.
Yeah, Mayor, when Mayor Nirenberg was on the show, it really opened my eyes because they started sending San Antonio some of the people from overseas that were Americans, like the cruise ship, people that were infected that were Americans got brought to San Antonio. And as a normal person who lives here, and some of our electeds were very unhappy this was happening. But, Ron pointed out this allowed us to get ready. So we already had people in our backyard that we knew had it. It allowed us to get ready for this coming wave. And he credits a lot of that with why they were able to jump on it so fast, which I thought was great.
Well, there's so many things that need to be done right, and I think they all were being done right. Yeah. In terms of anticipation of visitors, and in terms of tracing, and in terms of restrictions. I mean, you have to do them all, and they were all being done. But the good news about this is if you do them all, as San Antonio was able to do, you really do control the virus, and you can stop its spread.
Yeah, proof's in the pudding.
Yeah.
Yeah. So I hate to kind of 101 with you, but I think it's really important for our listeners to understand who you are and sort of your history in epidemiology. And honestly, we're in an era of social media science and social media, experts. So talk to me generally about what an epidemiologist's, real focus is and how you yourself got into it.
Yeah, I'll tell you that. Let me just say there. So my story is basically this. I'm a physician, and I'm an infectious disease physician first, and then an epidemiologist. And then I have been working on epidemics full time for about 40 years. So, first I was asked to run the tuberculosis control program for San Francisco in the early 80s when they had the worst epidemic in the country of tuberculosis. I then moved to Somalia to do tuberculosis among 1 million refugees in 40 camps. And then we got confronted with a cholera epidemic in Somalia when I was living in Somalia. I left that country when it was moving into civil war and got picked up by the World Health Organization and got assigned the management of the global program on AIDS, which Central and East Africa, the 13 countries in Central and East Africa, Uganda, Rwanda, Burundi, and the countries around there. In most of I co-led the cholera epidemic in Somalia. I led the TB efforts in Somali refugees, and I led the efforts in Central and East Africa on AIDS. And I just want to say for almost all of these things, these were problems in which behavior was all we had. From 1980 to 1995, there was no treatment at all for AIDS, and 30% of the populations in some of these cities were already infected. So we had community spread, we had a contagious virus, you couldn't tell who was infected, and all you had is behavior. And we got 70-75% drops by behavior change, and not an easy behavior, which was sexual behavior, not an easy thing to change. But to your point about what an epidemiologist is, I want to say there's many people who are now using this phrase, some of whom are virologists and some of whom are clinicians and care for patients and so on. But the management of an epidemic management is a subspecialty of epidemiology. We're not the people who are doing projections or models,
Sure.
or we're managing epidemics and we have to succeed at reducing them. It's a subspecialty of epidemiology, which is epidemic management and control.
Yeah.
That's what I've been doing. Yeah.
What? So I listened to your TED talk, and you said when you said you were going to Somalia that your boss said you made the worst decision that you could make to go over there. What was the impetus from saying I'm living in San Francisco and I've got a nice job, managing something and learning, but I want to go to Somalia, which at the time was, not a nice place to be, is my understanding.
Well, I was asked to consult in one refugee camp, the Boho refugee camp. And because other people from San Francisco General, including close friends and colleagues, were working there in the refugee situation. And so I went there to consult, and I got really excited about the people and the situation. And I was then kind of commuting between San Francisco and Mogadishu, even more up country,
Wow.
for a few years. And then myself and my colleague, Sandy Gove, we decided to move there. And because the problem was very, these were 1 million refugees in 40 camps, and there were only 6 doctors.
Jeez.
And, I felt that the TB program in San Francisco was pretty much under control at the time, where most of what had to be done was done. So, I was younger, and I took it as a challenge and a necessity. We did the math as to how many cases there were, 25 to 50,000. I thought we had about 500 in San Francisco, and I thought we had it managed. So it was like I felt I had to do it. That's kind of the way I grew up.
You then got into the World Health Organization, and you had some incredible successes, specifically in Uganda, in addressing the AIDS epidemic. Can you talk to us sort of about how that was approached differently, or how y'all were able to get more success in Uganda than maybe some of the other countries?
Yeah, these are such great questions. So, I'm lucky. I got picked up by World Health, and I got to work. I was kind of working, Sandy and I were kind of working on our own in a way in Somalia. I've been working at San Francisco General with a great team. Now I'm back at a great team at the World Health Organization with the best epidemiologists in the world. My boss and mentor is Danielle Tarantola, who had eradicated smallpox from Bangladesh. Right down the hall was, all these superstars, and I'm young, I'm in my 30s. And so, but they gave me a very big assignment. They gave me the epicenter, the 13 countries in Central and East Africa. They're the hardest hit. And I went at it, and they gave me a team. I built a team. And what did we do? We had to first find out how big the problem was by testing. We had to do a bunch of testing to find out where it was, how fast it was moving.
Sure.
Because it's invisible without the tests. And then we had to set up infrastructures and networks, and we saw that we had to do training, and that we had to figure out a strategy. It was a brand new disease. So what are we going to do? We landed on public education, information, and behavior change. And so what was done was, and Uganda is the best example because it did the best implementation, public education to scale, billboards, leaflets, flyers, pamphlets, media, spokespersons, ministers, clergy, refugee situations, military, everybody trained in very, very visible public education on sticking to one partner, and then on condom use. And then we had outreach workers, who can help people understand why they need to change their behavior. Now you can recognize kind of what's missing here for COVID, because we need very, very strong, very visible public education on wear a mask, keep your distance,